And again, I'm a renal nurse practitioner. It's part of my training. So at some point, we began to find out that there's so much blood. In fact, those that are medical doctor or nurses among us will understand. When you dipstick me, it's going to go very high blood. Although you don't see frank blood, it's hemolytic. So it's complete blood and then protein. I was referred to specialist clinic and they couldn't do anything. When you have problem, but you don't know what to do, they couldn't do anything. They just say I should just continue like that. Nothing. And as well, because I'm a renal nurse practitioner as well, I knew that there's nothing they can do. So I was looking and going gradually towards the dialysis, hemodialysis myself. But I don't know how God preserved my life. It took so long because normally people go quickly into that. And I just left it like that, managed my, just continue with life. Until 2018 in December, the problem began again. Then I visited my doctor 2019 December, and they told me that, look, the level of damage to your kidney and to the liver, we don't think you should do anything. There shouldn't be anything to be done. It's like complete failure of the kidney. When I wee, it's complete crystal clear water. And I've seen that for so long, about 12 years, I've been going through that. And it will form as well. When I wee, you hear the shh in the toilet, it just like it forms, like you put detergent and then it forms up. Every day I look at it, every day, and as a nurse, I dipstick myself to see whether miracle is going to happen or not. But nothing is happening, so I live with it. Until that December, when they told me that, look, all that you have seen and all the blood tests and all the scan and all the whatever they have done is showing that there is complete failure and we are not going to do anything about it. So they told me, according to my blood test result and everything, that I have only 3 months to live. 3 months. How can I quantitate that? My children are young, very young. They were 7 then. And we all went together to the GP. They all sat me down and said, that's it, no help. Well, I said, you have never given me any help before anyway. So I returned back home. That night, when you hear you are going to die and it's solid, you yourself, you are a nurse, you can read it. I thought, you don't have to cry. What do I do now is to plan for my children. I began to look for a way out to plan. I just went to the bank, do insurance. The little money I could lay my hands on, I did my funeral thing by myself. I bought everything that needs for funeral because my children are so young. I just was planning so that it won't be too bad. So after that, in fact, the person that brought me to PhytoScience, she's right on board now. She's called Mrs. Aduo. That's the person beside Martin at the moment. I met her briefly. She doesn't know me before. I met her briefly with one other sister, and she just liked me. She said, can I visit you? I said, oh, no trouble. For the first time, she came to my home. And on our way out, she told me, she said, sister, can I introduce you to something? And I said, okay. So by then, I was feeling weak. I fall all the time. I couldn't stand straight. My memory has gone. I couldn't remember things. When I'm talking, I will be, there will be block. It will be blocked and I can't continue the sentence. I was still walking, but I was walking very dangerously because sometimes I can't remember my patient. When I see people, I can't remember them. I knew these are people, the memory wasn't there. When I'm walking, I can't remember to prescribe right. And it was becoming very dangerous. I can't stand on my own because I will fall. The weakness was so much. So she got me through the weakness. She said, oh, this thing that we are selling, this PhytoScience, she presented it very short because my brain as well can't take too much long talk. So the way God prepared it was good. It was so short discussion. And I said, how much is it? I said, I always feel very weak and falling. So she said, oh, this can help you with that. So that's why I got interested. But I don't have the money. When she said 75,000 naira, then I was like, God, what is that? But then I didn't put her down. I actually was like, okay, give me your account. If I have money, I will do it. I was thinking in my heart, if I leave, I will do it. If I'm dead, then there is no point. So she gave me a telephone number and the bank account that I should drop the money in. And I just forgot about that. So I've paid the money. Where is the medicine? We don't know about the DHL, to bring medicine from Nigeria, or I don't even know whether they call it food supplements or anything. I just call it medicine. So eventually, Gigi Olauke, our leader, our coach, was coming to London, and they said, oh, Mary G went and quickly said, there's a lady you must give this to. So he was the one that brought it in. They don't know that I was sick. They were just doing their own thing that they know how to do. So they brought this PhytoScience thing. Brajide told me how to use it, put it under your tongue and all that. So they did. So the first morning, after they have left, I put it under my tongue. I did the first day, the second day. Before that day that they came, I've started to itch. The whole of my body is on fire and itching. I was, doing that and hurting myself and cutting through. It was terrible. So, but immediately I used the first morning, then the second morning, I found out that something gradually stopped, itchy. I don't know what it was. I thought, what's going on? Because I couldn't explain all this thing. It's just happening, and I'm just looking at what is happening. So by the time it came to the fourth day, I just went to the toilet that very morning, and when I finished weeing, I just wanted to turn back and flush. So I flushed my urine. What? Before I could flush, my hand was just back like that. It's like the ambers came back to my urine. For 12 solid years, I've not seen a yellow kind of urine. It's always been crystal white. That stops me, and I was like, what is this? Again, there is no frothiness anymore. No frothiness, no, that leather thing. It's all gone. And I looked, and I was like, what's going on here? So by the time I turned out, I noticed that no more itchiness. So in a week after that, I decided to see my doctor and said, doctor, something has changed in this body. Let's look at it again. Let's look at it again. So they looked at it. They did all the tests they are doing, and they found out that nothing was wrong again with my liver and my kidney. My doctor, the nurse, everybody, they called themselves. We sat down like a conference thing. They did it for me. And they pulled all the results, and we sat there. In fact, they couldn't close their mouth because they knew what it should happen. And not only that is my testimony. I have my twin children. They are twins. They're called Goodness and Mercy. One of them have asthma, and the other one have eczema. It was to the very bad. The itchiness. It will itch, my boy will itch, even to blood coming out of his skin. We've lived with that since they were born. The one with asthma, we don't sleep at night. We continue to hospital. Almost every night I am being wheeled or taken to the hospital. I will carry one on my back. I will carry the other one on my hand. There will be resuscitation sometimes. Because of the nurse, I resuscitated my girl completely out of breath twice. And every night is the same. So I thought, oh, this thing that I not used, why can't I use it for my children? I was initially afraid or terrified because in England, if you go and use anything, you go and kill one of them, you might be sued, and another story will continue from there. So, but I thought to myself, okay, as a nurse, the adults and children dosage is different. So I began to have it. So I will have the double stem cell. I gave it to them at the same time in the morning, and we drink. And before we know it, in a week exactly, I noticed there is no single asthma attack in my home. Completely. I need to tell you, up till this moment, we have not had another one asthma attack since that 2019 around March, April. Up till this moment. And the boy with terrible eczema on his skin, completely beautiful skin, very smooth, soothing skin up till now. So I want to thank PhytoScience again. I have lots of testimonies since this has happened to us. I have been it's a sort of great propaganda. All my members in the church, everybody is phytoscientifically, signed. That's the way we get it done. In my community here, the children that have asthma, eczema, I've sorted them out. Those one with epistaxis, bleeding through the nose, I have given to them. They are completely free. No more bleeding through the nose. So this PhytoScience product works. If anybody comes around and says it's not working, I'll just know that person is not using it. There's only one answer to it. You are not using it. Or you are using it, you don't want to put money, you use one and you think you are using PhytoScience. So PhytoScience work, it works everywhere. I've used it for different diseases. I've used it for people that are looking for the fruit of the womb. I've used it for people with fibroid, and you see the fibroid coming down, except for those ones that are really big. For those ones that are little fibroids, they just come out, and we've had lots of testimonies. So thank you, PhytoScience. This is my family. That's why you see me, I'm here all the time, because this is my business. This is my family. I'm ready to carry it through, completely through. I'm in for it. Nothing set me back. Thank you very much. Thank you for listening.
Thank you so much, okay, for our evangelist Mary from UK, okay? I have been listening her.
I want to ask her is, for fruit of the womb, how do you go about, how do you take these products, or how do you administer these products, stem cell for fruit of the womb, to be successful?
Thank you, Ma. I will use an example of, if it's fibroid, if they have fibroid, we need to deal with that first. And the way we deal with that is double stem cell and snowfifort. Actually, if they have some more money with them, they can do with crystal cell as well. But if they don't have lots of money, that's one of double stem cell and snowfifort is enough. It brings out fibroid, especially if their sizes are not too many. I have some of them, like Nature Nurture, one of my partner here, who had that, just taking it for back pain, and find out that the fibroid came out. So I had somebody with endometriosis who has been waiting to have pregnancy for 10 years of her marriage with no help. The endometriosis was very, very extremely bad. So what we did with her is that we bought a platinum package, and we had double stem cell, snowfifort. So the snowfifort was 2 months. We use that for 2 months. It helps to pull back and to dry up, or it does something to the womb that the endometriosis was just completely done. That's what it does. Then alongside, we are using double stem cell. We nearly finished the platinum package. Nearly. So when she was pregnant as well, we had lots of problem of threatening abortion. Threatening all the time. But we stabilized again with double stem cell alone. Lots of blood. They will call me very at night, and I will wake up many times. So we stabilized that with double stem cell as well. So immediately she was pregnant, we stopped the snowfifort. But she has used it for consecutively 2 months. And that has subside the endometriosis. So
she continue with the double stem cell?
Double stem cell, yeah, is good. But I remember that when she said she was pregnant, I just used the knowledge of nursing to say, okay, while the first trimester, don't use any medicine, because that's when the formation continues. The reason why I said that to her was that I don't have knowledge of using it for anybody that was pregnant before. But however, it is safe. It is safe.
So you don't have to use it when you're in early pregnancy?
No, that's not what I'm saying. With my knowledge then. My knowledge, you as well, I know you are a nurse. You know, in nursing, when people are in their first trimester, we don't want to allow them to be using anything. We want the child to grow just normal. So I just had that thought, and I said, just stop, let that first trimester go, and the baby is formed. So in fact, we had twins baby.
Okay.
They were twins.
Thank you so much. Thank you so much. My answer is
as well to stabilize pregnancy. Yeah, if they are being threatened, even when they are bleeding, terrible bleeding, they will call me almost every night, the pool of blood, and I'll say, take double stem cell. We struggle, and we got those two twins baby. We have brought them to this platform before for testimony, and yes, it helps to aid pregnancy. I've dealt with those of people with polycystic ovary, cysts in the ovary, and it works as well. They gone for scan, and they find it that is diminished and gone. So we can use it. Yes, we can use it.
Okay, we can use it even if it's threatening.
Yes, that's what we did for that lady, and even about 3 days to the birth of the children, we were in pool of blood, and all we did was go get the double stem cell, take it, rest. We rested this lady because she had lots of problem.
Okay, thanks so much. Why I asked this question was because I knew somebody, or not even around me, who when she's pregnant, she's always passing running stomach. I don't know what is the matter. She's always passing running stomach so often. So I think in this case, we can use double stem cell too.
Double stem cell is very good. And our crystal cell, they are both the same. But I think the crystal cell is more with any people with growth. Although double stem cell can do that as well. While I had no knowledge when I first started, I've used double stem cell to take care of cancer of the breast. And totally, she was cured. I'm sorry to say cured. I'll sip my mouth. But that was what it is.
Thank you very much. You are blessed for us today.
Thank you.
I can hear you.
Yeah, good evening, everyone.
Yes, good evening. Do you have testimony to share?
No, I have a question to our co-host evangelist from the UK.
Okay, I think this is the last question for Mary. Yeah, otherwise, Dr. Mary, you will need to answer a lot of questions. Yeah, please proceed.
That was a very interesting testimony from evangelist. I mean, the presentation from evangelist Mary and testimony. Now that brings me back to the doctor to my sister, and she has a problem with conceiving. She's a girl. We've always sat with her. She talked to us, telling us that she's never had any abortion. She's never had any pregnancy before. But then now she's getting married, but she has the problem in conceiving. She went to hospital. Nothing was wrong. All the tests have been done to her. No fibroids, no anything. And yet she can't conceive. So what can we do for her? Because I was trying to bring her in. I talked to her about the PhytoScience company, and I'm trying to bring her in so that she can listen to the presentations and testimonies and learn more about the products. so that we can see how she can get help here. But she's so much devastated and everything, I don't know. But how can we help?
Yes,
we
must all know that when people are saying they couldn't conceive, it means a lot to them, to the entire family. But as nurses or doctors, what we do is investigate first. We make sure that we establish the underlying problem, and normally it's the underlying problem that we deal with. It can be physical, like in structure of the womb. It could be internal of the womb. It could be fibroid within the womb, or outside the womb, or in the middle of the muscles of the womb. It could be fallopian tubes blockage. It could be hormonal. Myself as well, I was unable to conceive until age 50. My twins were conceived at the age of when I was 50. I had tried for pregnancy for 27 solid years before eventually that happens to me. Then it was not PhytoScience, because I had to go to hospital and they had to take care of me. So the underlying problem is the first thing that we looked into. If there is a case where there is nothing, they have looked at the fallopian tubes, it is patent. They have looked at the internal of the womb, or even outside of it. They have looked at other surrounding organs that they are not pressing on the womb. If everything is fine, how about the hormones? Because I realized that when they were taking care of me here in UK, when we were struggling, we were young, they did not really deep down into hormones. If it is fibroid, she needs to remove it, but she's not having fibroid. The secret, the one that can be hidden, is the hormonal imbalances. On the long run, I got to know a doctor, and I went there in Ghana, and Dr. Joseph Meno of Ghana in Tema, Accra. He was the one that eventually sat down and said, "You have done 9 IVFs. Why are you not successful?" So they sat me down, we looked at it, we went straight to hormonal. So hormonal, if prolactin is very high, it means that there must not be conception. When the prolactin is high, it's telling and informing your body that, look, that lady is breastfeeding, do not embed another baby. And if that is going on, she will look beautiful, she will not look aging like other women, because rates of prolactin. Let them look at their prolactin. Let them look at estrogen, but progesterone, whatever, all those hormones, follicle stimulating hormone. Let them look at that. That's the next thing. But if everything is then fine, we look at the husband as well. They do sperm count and make sure that his sperm count is good. Not only the sperm count, but the quality of the sperm as well. If we can get all those things right, okay, and even if we cannot get it right, double stem cell will do it for you. It will go into the body. It can help the hormone. Oh, how I wish that I've come across PhytoScience then. It would have done the job. Because ordinary prolactin was what took me forever to conceive. So let her use double stem cell, not crystal cell. If she has got any growth, cysts, like fibroid, she can add crystal cell. But if it is hormonal, let her go straight to double stem cell and snuffy fort. Because most Africans, we don't normally detoxificate. Some of us are even up to 60 years, we've never detoxificate. So please, let her detoxificate for that 2 months continuously, and continues 1-1, just 1-1. It's a very easy problem to be solved. 1-1 double stem cell. Thank you very much.
Thank you. Thank